Welcome back to We Are Austin. November is National Diabetes Awareness Month, and Rosedale Acupuncture and Wellness here in Austin is known for helping patients with diabetic-induced peripheral neuropathy. Owner and founder of Rosedale, Dr. Lucas Brown, is joining us to explain this treatment and share how they help their patients find relief. Good morning to you, Dr. Lucas.
Good morning.
Great to see you again. Can you kind of explain to us and tell us more about diabetic-induced neuropathy? What is it?
Well, of course, yeah. So a lot of people understand diabetes and neuropathy because that's the most common cause. There's definitely other causes of neuropathy we see quite commonly here in the clinic, but, don't get me started on that. In general, neuropathy is a degeneration or a demyelination of the nerves.
Mm-hmm.
For diabetics, it's because over time, high blood glucose or sugar levels damage the small blood vessels that supply the nerves in your body.
Wow.
Basically the nerves are starved and suffocated, no oxygen, no nutrients.
Mm-hmm.
And the pain is the nerves saying like, hey, pay attention to me, I'm drowning.
Mm-hmm.
And at a certain point that goes away and numbness sets in.
Oh.
And that comes with a whole host of other problems. I mean, really, it's an insidious disease that creeps up on people.
Mm-hmm.
If they've had diabetes for 20 plus years, odds are they're going to have some form of neuropathy.
Oh,
And
wow.
the sad part is that for the majority of these patients, it's quite often the quieter kind, not the painful kind. So they don't really realize how bad it is. It kind of skips the pain and goes to the numbness, which is really alarming for diabetics because their immune system is already compromised, their immune system response. And so if they get a wound on their foot or their leg, they don't see it and they don't feel it, it can get infected. And then, we're cutting off a toe, we're cutting off half a foot, we're cutting off a leg. It can be pretty severe.
Wow. It really does sound like diabetes is much more serious than I would have thought and goes well beyond just managing your blood sugar.
Pre-COVID, diabetes was the 7th leading cause of death in the US. Diabetes is a major cause of kidney failure, heart disease, heart attacks, stroke. And for reference, heart disease is the number 1 cause of death in the US. Stroke's number 5, kidney disease number 10.
Right.
So, millions of people are dying each year from diabetes, and it's completely preventable and manageable if you take action.
Right, take action.
Yeah.
So what preventable and manageable steps should one take after a diabetes diagnosis? And really, how does acupuncture treatment help?
Well, that's a great question. And Chelsea, I actually have a surprising fact for you. 1 in 5 people with diabetes don't know they have it.
Wow.
So, really the first step is the diagnosis, which is why yearly physicals and checkups with your primary care physician is so important.
Right.
We don't do blood work here in our clinic. And if you have diabetes or are pre-diabetic, you definitely need to be under the care and supervision of a medical doctor, and take their advice. A lot of times it can be managed with diet and lifestyle changes, especially if you're pre-diabetic, before it gets to the point of medication.
Right.
But here at Rosedale Acupuncture and Wellness, most of our patients are in their 60s, 70s, and beyond. They've had diabetes for over 20 years, and they're starting to see the complications of it, like neuropathy. And you've heard me say it before, I'm sure, and if anyone's heard me talk, they've heard me say it more than once. But the way that our care differs from Western care is Western care, they focus so narrowly on one thing, right? Like if you got a wound on your pinky, that's the only thing they look at, right? But here at Rosedale Acupuncture and Wellness, for us, you're like a whole person.
Right.
And Western medicine, pretty much the same treatment for everyone that's diabetics. But in our clinic, diabetes is not a one size fits all. It's going to affect Billy, Bob, and Sue a little bit differently.
Right.
So we have to treat Billy, Bob, and Sue a little bit differently. And, in the case we're talking about here, you're not just neuropathy in your feet. You're a diabetic person with neuropathy in your feet.
Right.
And we're going to treat the whole person, obviously with emphasis on the feet. Because that's what brought you in the door, literally and figuratively.
Right.
And so, but to answer your question, here, if each treatment were, say, like a movie, acupuncture may not even be like the leading role, the leading character.
Okay.
So what we do is so much more than just acupuncture, and I think that's probably what sets us apart from other clinics.
Right.
We like to blend the ancient art of acupuncture with more modern, cutting-edge treatments, and we don't want to rely on any one thing to get the results we do, but
Hmm.
we can definitely help, reduce the other side effects of diabetes, right? So
Hmm.
we stimulate their immune response system, they heal faster, and that's obviously one of the reasons we can help reverse the diabetic neuropathy.
Hmm.
And when they get a wound on their leg, we attack that with our wound care process because, chances are I'm going to treat one or two or three wounds on any diabetic while they're going through the neuropathy program.
Right,
And we
right.
literally are saving limbs here. Sorry, not, potentially saving lives, definitely saving limbs when it comes to wound care. And, but again, like I want to be clear, like I'm not saying we're going to cure diabetes. We're not going to fix congestive heart failure.
Hmm.
But for, lack of a better analogy, we can really reduce the speed of the diabetes,
That's
and then we're
amazing.
staving off moving into congestive heart failure, or we're slowing down
Yeah.
the process. And for some patients, we can get back to the point where they're able to manage their diabetes
Right.
with diet
And
and
that's the
lifestyle.
goal. Exactly. And that's the goal. But to know that acupuncture can help a diabetic is fascinating. So thank you so much for sharing that information with us this morning, Dr. Lucas Brown. Where can we go to learn more information about Rosedale Acupuncture and Wellness?
Give us a call. If I've said it once, I've said it a million times. It all starts with a conversation. But I definitely think it's important to know the limitations of this medicine, and I can't help everyone. And again, we're not really looking to cure diabetes or anything, but we can help manage the symptoms.
Mhm.
But again, every patient's different. It starts with a conversation. And so, I'd like to start just meeting the patient, going over their health history, and set expectations of what treatment might look like and what we can realistically and typically expect to see.
Realistic expectations. I love that. Thank you so much, Doctor, for joining us this morning on We Are
Thank
Austin.
you.
Hope you have a great day.
All right. Thank you. Appreciate it.